First of all, thank you for allowing me to give this talk. And I did give it at the museum conference last October, which seems like a lot longer than less than a year ago. So I apologize to anybody who's already heard it from last time. But as you can see, the talk is about the history of the Army Medical Museum, which we currently call the National Museum of Health and Medicine. That is Surgeon General William A. Hammond. So on March 21st of 1862, Surgeon General Hammond issued Circular Number 2, which directed the medical officers in the field to collect specimens of morbidity, anatomy, along with projectiles and foreign bodies, removed to and forward them to the newly founded museum. After that, he issued what we call Circular Number 5, which you'll see here, which required that all physicians write and submit a case history or essay along with each specimen or photograph submitted to the museum. And Hammond was, particularly Brinton, which we'll talk about, was particularly strict on this. The museum is its mission from the beginning and to this day, to inspire interest and promote the understanding of medicine, to identify, collect, and promote specimens of morbid anatomy, and to promote innovative exhibits. And we have 5 collections, which is when we talk about the logo of the museum, that comes into play. One is historical, which is the Civil War collection, which indeed is the core collection of the museum from which it started. Anatomic, which we'll talk about later, about preserved organs and plastinization. Neuroanatomy, which has become an important function of the museum right up into the present day. It's still relevant, working with traumatic brain injury, human development, and of course the Otis Historical Archives, which has to do with the medical and surgical history of the War of the Rebellion. So the first curator of the museum was this gentleman, John Brinton. He was the first cousin of General George McClellan, and he also was indeed related to the aforementioned Daniel Brinton. He was a graduate of Jefferson Medical College, and indeed his uncle, Dr. George McClellan, was the founder of that medical school in 1824, and indeed Daniel Brinton was also a Jefferson graduate. He was a brigade surgeon early in the war who served on General Grant's staff. Now, it's interesting that Brinton got assigned out west, initially to Cairo, Illinois, and he actually groused about being sent out there because he wanted to be on with his cousin, George McClellan. Of course, it turned out it was the best thing that ever happened to him because he became very close to General Grant, and they became very good friends. And of course, Grant's star rose and McClellan's fell. Early in the war, as I said, he was a brigade surgeon. He was the first surgical curator of the museum. Now, in 1864, in the fall, he was abruptly replaced and sent to Louisville. And so Brinton couldn't understand why this happened. So he went to his superior and he said, what's going on here? He said, I haven't done anything wrong. And he was actually had performed very well. And they said, well, let's see, what is your middle name? Or what is your last name? And he said, well, I'm Dr. Brinton. And he said, well, who's running again? What's the name, the middle name of the guy running for president against President Lincoln? That happens to be Brinton also. Well, what happened was they were basically, he was a Democrat, and so they purged all the Democrats, and anybody who was viewed as a possible supporter of McClellan against Lincoln got the axe. He was the first, he was after the war. He actually, if you know about that famous painting of the Gross Clinic at Jefferson, he was the guy after the war who actually replaced Samuel Gross as chairman. And of course, those of us connected to the museum know that he liked apparently cherry brandy, so the museum came out with Brinton's brandy. Now, one of the things Dr. Brinton did, as you know, the way the specimens were transmitted from the field to the museum, they didn't have formaldehyde till after the war. So they were transmitted in barrels of whiskey. And indeed, the museum had its own distillery to come up with the whiskey to transport the specimens. But they had a problem. Either by train or by wagon, the specimens would be arriving, and the train people, and especially the wagon drivers, would be showing up drunk at the museum, and the barrels would be empty. So Brinton got the idea of adding tartar emetic to the alcohol, and as those of you know who in this group, everybody probably knows that tartar emetic produces, among other things, lots of nausea and vomiting. So once he did that, that sort of took care of the problem. Now, the first home in the museum was the Cochrane Riggs Bank Building in downtown Washington, 1862 to 1863. I believe it was on H Street. The Cochrane and Riggs had formed this bank, which subsequently became the Riggs Bank, very famous bank in DC, and today is the PNC Bank. But this building here was part of Cochrane's estate, his farm. Cochrane, being a Confederate sympathizer, left the country indeed during the war and went to France. And he came back after the war, but his property all got confiscated. Believe it or not, those of you who don't know, the major location of the museum was from 1866 to 1887, and that was indeed Ford's Theater. And what happened was, after the Lincoln assassination, of course, the government took over Ford's Theater. And in fact, Stanton said there'll never be another play held at this theater again. Well, that was true until 1968, when the theater was revamped, renewed, and my wife and I, before the pandemic, went to theater there. But at any rate, a large portion of the museum's history is when it was at Ford's Theater. And indeed, the bulk of the medical and surgical history of the War of the Rebellion was written while the museum was at Ford's. The next location of the museum was on the Mall at 7th and Independence. That today is the location of the Air and Space Museum. And that was there from 1887 to 1947, and then from 1962 to 1969. And there you can see what the building looked like. It was designed by, and if there's any of you who actually grew up in the Washington, D.C. area, you may remember as a kid going to the museum when it was still down on the Mall. And it was designed by Adolph Kluss. It also housed the Army Medical Library, and also housed the Army Medical School up until 1910. And it had various nicknames, including Old Red and the Old Pickle Factory. And it was raised and replaced by the Smithsonian's Hirshhorn Museum in 1969. That's because Lady Bird Johnson, Hirshhorn wanted to give a lot of money to put a museum there, and Lady Bird Johnson put a lot of pressure on her husband to get rid of the museum and move it out to Walter Reed. And if you go around with Ed Bars enough, he'll say, yeah, they put a lousy art museum in there where the medical museum used to be. I referred to the Mishwar, the medical and surgical history of the War of the Rebellion, which the museum was largely responsible for. It was co-authored by J.J. Woodward and George Otis they wrote the volumes from 1870 to 1888. And indeed, the volumes are 6 volumes, 3,000 pages, weighing 55 pounds. And we indeed display the original volumes. You can see the picture there on the left of the Mishwar. It summarized statistics from field hospital reports, and included hundreds of etchings, wood engravings, photographs, and color plates of specimens and wounded veterans. So I think everybody in this audience is pretty familiar with the Mishwar. And if you're doing any kind of research in Civil War medicine, you're looking for statistics, it's sort of the go-to reference. Of course, when I started, it was still in volumes like that. Then I remember when it went to CDs, And then ultimately now, of course, it's online. So it's gone a long way from when you had to have, if you wanted the Mishwar, you had to get all those volumes. Now, this is what Hammond actually thought about his legacy and the museum. He said, there are few things in my professional career in which I take more pride than the ideas of the Army Medical Museum and the medical and surgical history of the War of the Rebellion, which were conceived by me. Hammond was not modest. Now, the Army Medical Museum, after it left the mall, it went to Walter Reed Army Medical Center in the basement of the Armed Forces Institute of Pathology building, where the museum was housed up until 2011. And if you know what happened with the military in 2011, it's when Walter Reed was closed and everything was consolidated at Bethesda, and everything became Tricor, the joint base this and joint base that. And so they are all the three major branches of the military all have sort of consolidated, and everything now is at Bethesda. Now, when they moved to Bethesda in 2011, they did not have room for the museum. So where it did move to, of course, is Forest Glen, which is the current home of the museum. And that indeed is, interestingly enough, actually under the auspices of Fort Detrick, which of course has the connection to the National Museum of Civil War Medicine. Now, along with George Otis, one of the major author of the Mishwar, George Sharp, became involved in the last volume, but basically Woodward and Otis were the two principal authors. He performed, in addition to that, Woodward performed and wrote reports on the autopsies of both Abraham Lincoln and John Wilkes Booth. He co-authored, as we said, the medical and surgical history of the War of the Rebellion with George Otis. He was the guy, one of the people who attended to President Garfield after he was shot. He was the first scientist to establish photomicroscopy as a tool for both scientific and medical investigation. His technique using aniline dyes for thin sections of tissue and his work in photomicroscopy helped prepare the groundwork for modern surgical pathology. And we indeed, you see the picture there, have normally on display Woodward's microscope. And he was president of the AMA from 1882 to 1883. And then, of course, there are, as I said, those volumes. Now, I'm going to talk a little bit about the Mishwar. It's a 6-volume, 3,000-page study, which, as I said, was written between 1870 and 1888 in the direction of Barnes, who was the guy who succeeded who succeeded Hammond, and we know the story about Hammond and his court-martial. It's divided into 3 parts, each consisting of a medical history volume and a surgical history volume. The work details tens of thousands of surgical cases and diseases occurring during the war. And of course, it was the basic source for medical data of the war, on the war. It comprises important sources of medical information relating to individual soldiers, has the names of surgeons who submitted the case studies, which were almost always included. And that was one of the things Brinton early on instituted and insisted upon, that these reports be very complete and had all the names and documentation. And if you didn't fill out if you were asked by Brinton to submit a report and you didn't do it in a timely fashion, he was on your case. Hundreds of etchings, wood engravings, charts and tables, as well as photographs and color plates occupying the text. And the surgical volumes were indeed written by Otis. 2 medical volumes were also prepared. Woodward did most of the medical volumes, but as I said, Charles Smart came in at the end afterwards. And this is just some of the typical things. You've all seen this that are in the Mishwar. Uh, we have all kinds of illustrations, diagrams, photographs. Of course, it didn't have X-rays, so we had to have this in place of that. But this has just been an invaluable resource. I used it considerably when we were doing Mercy Street, the second year of Mercy Street, when I was assisting them a little bit with as a technical advisor. They would ask questions. Did they do this? Did they do that? Some of the stuff's sort of obscure, like did they do spinal surgery? And you could go to the Mishwar and figure out if they indeed did do it. And it wasn't done very often, but like 2 cases were done, and they were actually done by Woodward. And this just shows what's in there, and I'm going to elaborate on that. So here's Woodward's description. The records thus accumulated embraced over 16,000 folio volumes of manuscript, record books, and several tons of manuscripts and papers. Here's what Otis said about it. The extent of these materials is simply enormous. The returns are of as huge a proportion as the armies that have been engaged in active operations in the last 4 years. The great body of medical officers have made the reports required of them with commendable diligence and promptitude, and their zeal is more deserving of praise when the engrossing nature of their field duties is considered. The result has been the accumulation of a mass of facts and observations in military surgery of unprecedented magnitude. So if you get the 19th century language, but he was pretty impressed. And of course, we had Woodward's microscope. Now this is what the museum looks like today. Transferred to the U.S. garrison at Forest Glen, Silver Spring after closure of Walter Reed in 2011. And like I said, it is under the auspices of Fort Detrick. So when we get you have to get a pass to be a docent there because you have to come onto the base, and it'll say Fort Detrick on it actually. And this is the museum logo. It says 1862 on it, which is the year the museum was founded. And it consists of 5 stars. Now the 5 stars represent the 5 collections, but it's also based on a constellation described in 1754 by a French astronomer, Nicolas de Calais, called Microscopium. So he apparently was a very active astronomer in that period in South Africa. And he described lots of constellations, but one of them, he thought that it looked like a microscope. And so with the 5 stars, the museum has adopted that as their logo. And indeed, we have the Otis microscope collection, which we have a large number of microscopes in our microscope collection, including the microscopes of Hooke. I'll talk a little bit about that, and Van Leeuwenhoek. So the collection of the museum currently is 25 million artifacts. The anatomical collection has more than 5,000 skeletal specimens, 10,000 preserved organs, and 12,000 items of medical equipment. Collection supports research in pathology, physical anthropology, and artifacts and paleopathology. The Otis Historical Archive houses photographs, illustrations, and documents related to health and medicine. The Human Development Anatomy Center maintains the largest collection of embryonic material in the United States. The center is a primary source for centralized research for developmental anatomy and is known for its imaging and 3D reconstruction of embryo development. The Neuroanatomic Collection comprises 9 different collections focusing on human and non-human neuroanatomy and neuropathology. And I'll show you some illustrations later. And the exhibit galleries, which I had alluded to earlier, are advances in military medicine, anatomy and pathology, providing examples of healthy anatomic structures, collection that teaches is the Army Medical Museum collection, based on the museum's innovative effort to bring, that begun in 1862, to collect and collate and share the lessons of battlefield medicine during the course of the Civil War. And then the fragile organ is the brain, normal and pathologic anatomy, and also traumatic brain injury. We have a painting in the lobby, which is the World War II Rehab Center on Linden Lane. If you know Silver Spring and all, it's opposite the wall. It was called the Walter Reed Annex. This is World War II era painting. That was established indeed around World War II as a rehab center for both mental and physical rehabilitation, and it stayed open through the Vietnam War. Closed around 1976, I believe. It's now condos. When you walk into this thing, we have the skeleton, which the kids all like, at the entrance to the Civil War collection. And I'm going to give you a virtual tour of the museum, which, when I put this talk together, was for the purpose of this talk. Actually, what we're doing now, we haven't started doing it yet, but we are going to start doing virtual tours because of the pandemic. So when you walk into the Civil War collection, we call that the collection that teaches, and we talked about how the specimens were transmitted. So when you first walk in, you'll see a skull with a shell hole, and that's a skull from a soldier from the 54th Massachusetts. Carolyn in her Clara Barton presentation, of course, talked about Fort Wagner. And here's a soldier who did not have a good day at Fort Wagner. And then we have a vast collection of Civil War bullets. And so I get a chance when I have high school kids in there to teach them some of the stuff that we talk about at reenactments, about why so many amputations were done. And we have lots of really great examples of mini balls, expended and non-expended, so the kids can get an understanding of how they smash the bone and everything. And we have we only scratch the surface, of course, on what we show as far as our Civil War medical instruments, but you can see here just a sampling of the array of instruments just on display. And one of the reasons I asked about Mary Walker is because I get to talk about Mary Walker when I do the tours. We have some of Mary Walker's instruments here. We have her pocket kit and another one of her field kits. Interestingly, when you start studying about Mary Walker, she probably never did an amputation. Whether or not they wouldn't let her do one, or she wasn't capable of doing one, we don't know. That's an area of controversy, what her level of competence as a surgeon was. But she did treat soldiers, but she did not do major surgery. Now, my favorite, of course, is what we have in connection with Abraham Lincoln, the final casualty of the war. So we have an exhibition of items associated with Lincoln's last hours and the physicians who cared for him. And I think you guys have heard me give my talk on Charles Leal. But when we do the tours, you know, there are a lot of them are middle and high school students, and they're all texting on their phones and everything, and it's hard to maintain their attention. But when we get to this thing, I make them pay attention, because I say, you guys are really lucky. You live in this area where you get to come to this museum, and not too many people your age get to see a bullet that had such a profound course in American history. And of course, this bullet really did. And a lot of our students that come are African American students, and some of them are just blown away when they see this. And of course, we have now the surgeon who assisted Woodward, who did the autopsy on Lincoln. And when I give my Charles Leal talk, I talk about Lincoln's autopsy, was Edward Curtis. And a lot of what we know about the autopsy is because Dr. Curtis wrote a letter to his mother describing what went on. And of course, we do have Curtis gave his shirt to his wife to launder. And for some reason, she must have had a sense of history. She saw the blood on the cuffs of her husband's shirt and did not wash or launder the shirt. And so now we do indeed have the cuffs of Dr. Curtis's shirt stained with Abraham Lincoln's blood. We also have, not in our museum, but at the Smithsonian, we have Dr. Leal's shirt with Lincoln's blood on Dr. Leal's shirt. Now, if you know what happened in the Peterson house, the Surgeon General Barnes showed up. Now, we do have also some skull fragments from President Lincoln there. And we know that Surgeon General Barnes did show up at one of 16 surgeons doctors who showed up at the Peterson house. And he took a bullet probe, we're missing the tip of it, a Nelaton probe, and stuck it right into the president's brain. And I said he'd probably administered the coup de grace, but there is the actual bullet probe that Surgeon General Barnes used for that procedure, missing the tip. And we do have a lock also of President Lincoln's hair. Now, the other thing we have is relates to Henry Wurz. We heard Carolyn talk about Andersonville. We have Henry Wurz's collarbone, or one of his cervical vertebrae, and we have one of his bones from we have his radius and ulna. And the reason we have that on display is that, and you see Wirtz with his arm in a sling. At his trial, he was accused of beating up prisoners, of beating prisoners in Andersonville. And one of his defenses, he used as his defenses, he had this injury, which he was injured in one of the 7 days battles. That's how he ended up being the commandant of Andersonville. But that he couldn't do that because he had such a terrible injury to his arm. And so the reason we have the bone on display is that for what it doesn't show. It shows no fractures. So he may have had an injury to his arm, but he certainly didn't have a fracture serious enough that maybe he couldn't have done that. The reason we have the cervical bone is because it also, for what it doesn't show a fracture. So as you know, that when you hang somebody, the idea is if you want to be merciful, you break the neck and they die instantly. That didn't happen with Wurz. If it's up to you to decide if he got what he deserved. Of course, the most famous thing we have is the leg of Dan Sickles. Everybody who knows anything about our museum, they'll say, do you have Sickles' leg? And of course we do. And when I first saw that thing, I didn't realize that Sickles, I had read about it, but you see how badly fractured that was. And when you read the description of what happened at Gettysburg, they said his leg was amputated. Well, his leg was really amputated by the shell, which bounced up off the ground and hit him in the leg. His leg, what the surgeons did is just snip away some tissue, because that leg was essentially amputated by the shell. And you can see how seriously damaged that bone is. And we all know the story, I assume, that Sickles, of course, presented the leg with my compliments to the museum. And then after the war, he would every year on the anniversary, on July 2nd, he would bring a delegation to the museum from Congress and elsewhere and visit the leg, and then repair to a local tavern and listen to Sickles tell everyone how he won the Battle of Gettysburg. And indeed, this is the site where at the Trossel farm, somebody was talking about the dead horses. I think Ron was at the Trossel farm, and that is the Trossel farm where Sickles, indeed, his headquarters were, and where he lost his leg. And there is a monument at Gettysburg at the exact spot where Sickles got hit. So I got somebody to take my picture when we were up there for an event right where Sickles lost his leg. Now, everybody here knows about Dorothea Dix, who was the head of the Union Nurses Corps. Maybe responsible for hiring some 3,000 nurses. I've seen various figures, but we do indeed have her trunk on display. Well, we don't now. We've replaced it with the hospital ships, but until last December, I believe it was, we had Dorothea Dix's trunk on display there. You know, Dragon Dix, the museum even had the beer. As I said, we replaced it I think it was last December, with a hospital ships exhibit, which I show here. And one of the models that we show is the USNS Mercy. Now, this was a nice model and didn't have a lot of contemporary significance, although I'd been down in Norfolk on a tour and I'd seen it in port, which is where its home port is. But of course, the picture I showed, I just added that picture, is the Mercy coming into New York, because the Mercy was one of 2 hospital ships that was deployed during the height of the COVID pandemic in New York. It's a 1,000-bed ship. It actually was sort of underutilized in New York because initially, because of bureaucratic regulation and everything, they basically couldn't get a lot of patients onto that. Then they had to cut through the regulations, and they did end up treating more patients. But it was deployed, and its sister ship is the Comfort, which is on the West Coast, and that was deployed to Los Angeles during the pandemic. And I think, its home port is Los Angeles, and I think it was there. I'm not sure if it got up to Seattle too, but it was used also during the height of the pandemic. But of course, that these ships go back to the war. You can see examples there, especially were used during the Peninsula Campaign. The Sanitary Commission had these ships. So this is one of our newer exhibits. And there's the first one actually is the J.K. Barnes. This was the first ship. It was actually built specifically for a hospital ship. A lot of these were converted from other purposes beforehand. And we have Able, who is the first, not everything is Civil War. Able is a space monkey. He was one of the first, there was Able, the male, and Beta was the female, I believe. And they were used as part of the space program. And we have Able's skeleton on display. And we know that the story of President Grant, who smoked at least 25 to 30 cigars a day. He was actually not a cigar smoker until Fort Donelson, where erroneously a picture was published with a guy smoking a cigar. They thought it was Grant, it wasn't, and so people started sending him barrels of cigars. So he smoked a lot of cigars, and he ended up dying of cancer at the base of the tongue. And of course, you see him writing his memoirs there, which he completed 3 weeks, I believe, before his death. And it saved Julia from a life of poverty, because he made almost $400,000 on these memoirs. But we have, he had a biopsy. And of course, the biopsy, I believe, was interpreted at the museum. And we have those slides on display of Grant's tumor from its cancer at the base of the tongue. And we also have President Garfield's spine with the bullet embedded in it. You know the story about Garfield, shot in the train station, of course, in DC, was unfortunately subjected to the care of another figure from the Civil War, Dr. Willard Bliss. Bliss, of course, was president in the Peterson House the day Lincoln died. He was the boss of Charles Leal because he was the commandant of Armory Square Hospital, currently where the Air and Space Museum is today. And of course, Dr. Leal was the director of the Commissioned Officers Ward at Armory Square. But unfortunately, Bliss, at the time of Garfield's assassination in 1881, still was practicing Civil War medicine. He was not a believer in Lister. Lister had done his first surgery in 1867, And he was, by 1881, a lot of younger people, especially in Europe, were already adopting Lister's methods. But unfortunately, Garfield did not, or Bliss did not, and that probably led to Garfield's death. In fact, Charles Guiteau, who shot him, his defense was, "I shot him, the doctors killed him." But they hung him anyhow. Now, I talked a little bit earlier about our microscope collection called the Otis. We have, I think, over 750 microscopes, but we have some very famous ones, such as the microscope of Robert Hooke from 1665. Hooke being the first to describe microorganisms, which were fungi, and indeed he coined the term cell for describing biological organisms. He believed, when he looked in the microscope, that these reminded him of cells from a monastery, monk cells from a monastery, hence we got the term cell. And this is also, as I said, part of the Billings microscope collection. Because it's not Otis, it's Billings. And we also have Van Leeuwenhoek's microscope also, of course. Van Leeuwenhoek was the guy who really perfected the lenses of the microscope. And so the Michoir I've already alluded to earlier, and this is our display for the Michoir. And so I decided, even though we all look at it, has anybody systematically laid out what's actually in that thing, in each volume? So I don't know, it just interested me, so I thought I would throw that in, so tell you exactly what's in there, what each volume is. So it starts with part 1, volume 1, which is Woodward did, which in 1870, which is medical, and here's what's in there. It's a series of statistical tables summarizing the monthly reports made to the Surgeon General regarding the sickness of the Army, deaths and discharges, and is arranged into 2 groups. Part 1 is sickness and mortality of white troops, and part 2 is sickness and mortality of colored troops. The second volume of part 1, which is done by Otis, remember Otis did the surgical part. This covers wounds and injuries of the head, neck, face, spine, and chest, and includes a chronological summary of the engagements and battles. We go to part 2, the medical is back to Woodward. This covers diarrhea and dysentery, case studies and heliotype, illustrations of diseases and sections of tissue, etc. Part 2, volume 2, this covers injuries of the abdomen, pelvis, flesh wounds of the upper back, and wounds and injuries of the upper extremities. And part 3, this is volume 1, again, when we get to part 3, we're at Charles Smart, and we're at 1888. And this covers the medical statistics, camp fever such as typhus, and other miasmatic diseases, scurvy, we talked about, diseases attributed to non-miasmatic exposure such as nostalgia, PTSD, army itch, poisoning, alcoholism, and venereal diseases. And it includes one small folding map. And part 3, volume 2 is Otis, and they brought in D.L. Huntington at the end too. And this covers wounds and injuries of the lower extremities, miscellaneous injuries, wounds and complications, anesthetics, the medical staff, and materia chirurgica, and transportation of the wounded. So they don't miss much. Now we're not, as I said, we're not all Civil War. We have a fairly significant, interesting exhibit on World War I gas masks. We last year had the anniversary, of course, of World War I, of the armistice back last November. But interesting that we had something like 170,000 Americans were gassed in World War I. There were only 1,200 deaths. And gassing was not designed basically to kill people, but it was to disable them, either through blindness, skin lesions, or lung injury. And that required other soldiers and other personnel to get them off the field. So its purpose was not to just primarily directly kill people. We also have a fairly significant section devoted to forensics. And we even do a forensics workshop for school groups where kids have to come in and through various things such as the bone, you can tell we teach them how you tell the difference between male and female skulls and pelvises. We teach them about DNA and that kind of stuff. And then they get to do workshops where you give them an unknown and they have to identify the age of the body and the sex, etc. You teach them about things like, the closure of the bones, the metaphysis and diaphysis, and all of that thing. All that depends on the age of the kids, how much detail we get into with them. And then we have the stuff about virtual autopsies, of course, and the more modern stuff, multi-directional CT, which is now used, CSI kind of stuff, and DNA, and then transportation of the wounded. We talk about hospital ships and ambulances and hospital trains. We even have a thing where I get to talk about elephantiasis. We have a specimen of somebody who had elephantiasis. Of course, you know about this is caused by a parasite, Wuchereria bancroftii. This parasite obstructs lymphatics, causes tremendous amount of lymphatic swelling if untreated, which now we do have treatment for it, but if it's untreated, it gets to this stage. And of course, we have our friend Sergeant Peter Clucky, or Private Peter Clucky, who was a Spanish-American War veteran who was diagnosed with severe ankylosing rheumatoid arthritis and spondylitis, and basically Clucky could not get out of that chair. His joints basically are all fused, and he did donate his body to science, and we ended up at the museum with his skeleton. This is what I call the cabinet of curiosities, all kinds of medical disasters and curiosities, things like toxic megacolon, things like a bezoar, which is this one. I'll show you another picture of that. A young woman who had a mental condition where she ate her own hair and it developed a bezoar. We talk about conjoined twins, which we have a conjoined twin specimen that's joined at the chest. There's the bezoar from this 12-year-old girl who was had this mental condition. Previously, you actually had to operate on people who had this. Now, of course, with the advent of endoscopy, these things can be endoscopically dealt with. We also have the first dialysis machine, which was invented by Wilhelm Klopf during World War II. This is the first prototype dialyzer in 1943. And Klopf used orange juice cans, auto parts, and for the tubing, he used sausage casings. And Klopf also went on, after the war, ended up in the Cleveland Clinic, and was involved with the development of the artificial heart as well. And we have very extensive collection of prosthetics, including Civil War prosthetics and sunglasses. And, I always thought that only people gudiagnosed with syphilis during the Civil War wore sunglasses. But apparently not the case, that some guys actually would be known to wear sunglasses for other than medical reasons. But everybody knows about a lot of the stories about the development of the prosthetic industry. Really is one of the advances of the American Civil War. Certainly we know on the southern side about James Hanger, but equally on the northern side, and the whole program, of course, that the federal government had after the war for voucher system for providing prosthetics for soldiers. And the way the Civil War skeletal specimens are organized is by year. We start with 1862 and we go through 1865. And so there's examples from each year of the war, and anything you can think of, any kind of injury, any kind of gunshot injury, osteomyelitis. We have all kinds of specimens showing bone infection, which is osteomyelitis. And of course, you know, in my career as an infectious disease doctor, I saw lots and lots of osteo, but didn't get to see actually the bone itself very often. But until I started seeing what it actually looked like. Now, today we're not going to see this kind of advanced disease because of antibiotics, but there you could, in the specimens we have, you can see actually what untreated osteomyelitis looks like. So these are 1862 specimens here. Okay, now, another gallery we have some of the, I can tell you some of the smartest people in brain research affiliated with this museum. And so we have our brain gallery, which starts here with a preserved brain and spinal cord. And so when I get kids in there who've studied a little bit, we quiz them on the different functions of the lobes of the brain and so forth. Now, the big thing we do, if you know, those of us of a certain age all remember the smelly formaldehyde when you go to see organs in museums and so forth, swimming around in formaldehyde. You couldn't touch the organs. But in 1977, this guy, Gunther von Hagens, developed a process called plastinization. And this is a process where water and fat are replaced by certain plastic polymers. So the specimens can be touched, they don't smell or decay, and retain most of their properties of the original sample. So now we have all these plasticized organs that we can bring out. We actually, there's the cart, we bring them out, and the kids can actually pick them up, play with them, study them, get to see what they're really like. And, you know, they'll always say, those aren't really real people's organs, are they? Yeah, they really are. These are the real thing. And so the kids can really get a feel, literally, what these organisms are like. And von Hagens has done some amazing stuff. He's got one where he's got an entire pregnant woman with a fetus who died plasticized. We don't have that, but I've seen it. We have a lot of stuff. We talk about traumatic brain injury, and part of the thing is and you see the helmets of the soldier and the football player, and that's because the DoD has been and worked in conjunction with college and professional football in studying traumatic brain injury. And there's, of course, a lot we know now about traumatic brain injury. If you saw that Will Smith movie called Concussion, but we now know anatomically, pathologically, what the brain looks like in these football players and in military people who have suffered traumatic brain injury. And we talk about the levels of the severe or mild, moderate, and severe TBI. Of course, the definition of TBI is basically any injury to the brain which alters brain function. And we do talk a little about trephination, not just Civil War, but we happen to have Hammond's trephination kit. And according to statistics we have, only 222 trephinations were done in the war, and they had a 50% mortality. And if you read Chisholm's book, he basically says, don't do this unless you really know what you're doing. We also have our skeletal development. We talk a lot about skeletal development from fetal development from 4 months from 4 fetal months to the age of 5. And we show the kids, you know, how the bones fuse, how the sutures are present and then fuse, and you know how you're born with 276 bones, and you end up with 205 bones. Because of fusion. And our final gallery, of course, is the modern military. Well, it's not all modern. It's the military medicine gallery. I was going to say, here you see Revolutionary War medical instruments. And indeed, of course, you know, these guys did not use anesthesia. And you can see that their instruments are downright medieval. And I once asked a guy who was a reenactor, you know, why are they curved amputation? Just because we had to be fast, and they basically were doing guillotine type amputations that had to be fast. Some of the innovations that are used now in civilian medicine, of course, come from the military. One of the more prominent ones is pain management, which is PCI or PCA, I should say, patient-controlled anesthesia. That is a direct result of techniques developed in the military. We talk about evacuation of the wounded, again, which has a lot of civilian applications, but we all know about Letterman and the legacy of Letterman as far as evacuation of the wounded. Well, the modern adaptation of Letterman is what was used in Iraq, still being used in Afghanistan, called the Special Medical Emergency Evacuation Device, among other things, is the SMED. This has streamlined the way patient transport. You have all of these things. You have IV poles, oxygen monitors, all kinds of stuff. Well, this SMED puts all this together in one platform, making the transportation of wounded with all these devices a lot more expeditious. So we showed the SMED there. And the other thing we talk about, which is a direct, I would say, legacy of Letterman, is a thing called this critical care air transport team. And that is an Air Force, these are Air Force personnel, and there's a doctor, a nurse, and a respiratory therapist, and they fly the wounded from Afghanistan, previously from Iraq, to Germany and to Walter Reed. And this is an example, and indeed, I happen to have a friend named Dr. Alexander Karate, who was a member of the CCAT. He's an Air Force emergency room physician, actually trained at GW. And he's a friend of mine. So I asked, we do what's called these science cafes, back when we could do those. And so this was back in May of 2019, I guess I had Alexander. And I asked him to come out and talk to us about his experiences in Iraq. And he was really interesting. He was a big hit. And to me, it was really funny because one of the things he said was one of the biggest causes for anxiety is they would get a critic. I mean, this guy did some, on these planes, these transports, they could do almost anything. They would crack open chests, they could do surgery, intubations, all kinds of stuff. And he said he had to do all these kind of things. But he said the biggest fears that he had, one of the worst things was they get to Walter Reed and they have to get on the Beltway, or they get to Andrews, I should say, and they have to get on the Capitol Beltway to get to Walter Reed. And they run into Beltway traffic and they're stuck. And that can be very anxiety producing when you have a critically ill patient. I don't know if you can see in the far right, each one of these teams has a patch. And so Alexander was nice enough to give me one of his team's patches. So I have a CCAT patch now that I prize. The other thing we have is, this is Trauma Bay 2 from Balad, Iraq. This was an emergency room that operated between 2003 and 2007. This treated 48,000 patients with a 98% survival rate. So after the military is pulling out of there, of course, in 2008, and this is the floor from that part of the floor containing blood stains from Trauma Bay 2. And there happened to be a congressman over there visiting, and they were going to just destroy this thing. And he said, you can't destroy this. This is part of Army medical history and military medical history. And they said, they figured out that what would be a better place to send this thing is than to the museum. So we now have this part of the floor from Trauma Bay 2 on display. And we have indeed had some nurses come to the museum who actually worked at Trauma Bay 2, who've given stories about what went on there. And it seems like ancient history, but when we used to have the Letterman dinners at the museum, I met a guy, we always have a lot of Army military medical guys there being honored and so forth. And I met a guy at one of the Letterman dinners who had actually, and I said, we have this floor from Trauma Bay 2 at the museum, and he said, "Oh yeah, I worked there." So I got to hear some stories about what went on at Trauma Bay 2. We have a whole we have a thing here about Dr. Gurdon Buck, who I guess you guys know about. Buck did about 30 facial reconstructions in World War and in the Civil War in New York. I guess two of his most famous we talk about. One is Private Roland Ward, who was shot in the face, and you can see that what Buck did before and after with him. And then, of course, to me, the most interesting one is Carlton Bergan, who was not injured, but he had pneumonia, and he was given mercury, as a lot of people were, to treat his pneumonia. And of course, you all know that one of the side effects of too much mercury are excess salivation, dehiscence of the gums, facial oral lesions, and you can see what the mercury did to Bergan and what Dr. Buck did to try to restore his face. Pretty good job, actually, considering when this was. And then we show, of course, what happened subsequently. We have World War I, where they started to use a lot of these facial masks, all the way up to the present day, where we now use computers and computer imaging to do these facial reconstructions. We talk about Colonel Emma Vogel, who first trained as a physical therapist in 1922. She got appointed director of physical therapy in 1943 with the rank of major. After World War II, she was appointed the first director of the Women's Medical Specialist Corps, integrating physical therapists, occupational therapists, and dietitians, and was promoted to colonel. And it became the Army Medical Specialist Corps in 1954. And so I had the opportunity one time, we do special tours sometimes, and we had a whole group of people from Walter Reed who work in physical therapy, occupational therapy, dietitians, who came out because they really were interested in seeing what we had on Emma Vogel. And so we showed them what we have permanently on display, and then the curators brought all kinds of other stuff, including we have Emma Vogel's uniform. They wanted to, so the curators were able to dig up all kinds of stuff we had not on display about Emma Vogel. And these guys they all knew the story of her because she was like their guru, and they were very excited to see that. We have Chauncey, who is a copper mannequin manufactured by GE, which could maintain a constant skin temperature, and he was used to evaluate thermal insulating properties of military garments and headgear. And basically the electric, and a lot of military uniform and so forth were developed using this thing. But one of the things, civilian applications that came from this was, if you're old enough to remember, electric blankets. It came from that. And finally here we have the microscope of Walter Reed, who was the curator between 1893 and 1998 of the museum. Of course, you know that Reed was the guy who discovered that yellow fever was transmitted by mosquitoes. He actually gives a lot of the credit to a Cuban physician, Carlos Finley, who he indeed worked with. And of course, Walter Reed Hospital is named for Reed in 1909. This is the first hospital, I believe, to be named for a military surgeon. Reed himself ended up dying at the age of 56, ironically, from sepsis related to a ruptured appendix. And of course, he didn't have antibiotics yet, so Reed was a victim of the lack of ability to treat peritonitis at that time. And of course, this, as I alluded to earlier, is the cart with our plasticized organs, Civil War bullets, and instruments, which we usually show to the tour groups at the end of the tour. And I always end my talks by quoting one of my favorite guys, Winston Churchill. So why do we study history? Because the farther backward you look, the further forward you see. And I thank you. And if we have time for questions, I'll be happy to take them.